One of the easiest things to push off in life is your dental visits. Before I went to dental school, I would go years without even going to the dentist. Then I decided to become a dentist and everything changed. But seriously, if you push things off, they're gonna keep getting worse until it's too late. And when it's too late for one of your teeth, it's time to go. So I'm gonna give you 7 reasons you would need one of your teeth pulled out. Number 1 is your tooth is broken. Now sometimes you can save a tooth depending on how big the break actually is. But sometimes people have these really big old fillings and their tooth is already weaker, and sometimes they grind their teeth, putting even more stress on their teeth, and over time their tooth starts to crack. Or you can be one of those guys that likes to open bottles with their teeth and their tooth just snaps in one go. But if this crack isn't taken care of, it's gonna continue to get worse, and over time it can break. Now when a tooth breaks, it's really unpredictable. Sometimes it can be a small chip, sometimes it can involve the nerve of the tooth, and sometimes it can even go into the root of the tooth. If too much of the tooth structure breaks away, then you can't save it anymore, and that's when you would need an extraction. Number 2 is if you have a large cavity. A large cavity is basically a giant hole that forms in your tooth, and there's a lot of decay and a lot of bacteria that are just spreading. Now, if this decay and this bacteria spreads to the nerve of your tooth, that pretty much means that you need a root canal. But sometimes even that isn't enough. If most of that tooth has a cavity, or if the cavity has gotten really close to the bone that surrounds the tooth, then you're looking at an extraction. Now, if the cavity has gotten close to the bone, there are some other procedures that could save it, and one of the procedures you would need would be crown lengthening. A crown lengthening is when you remove some bone around the tooth and it effectively lengthens the crown of the tooth. Basically, this gives you more tooth structure to work with. But this may not always be the best option, because when you remove some bone around the tooth, the gums will follow it. So now if you put a tooth there, the tooth is gonna look longer than the teeth next to it. And if this is in the front of your mouth, I can tell you, you won't be happy. So in this case, you may be better off with a dental implant to replace that tooth. And in that case, you would have to pull the tooth. Also, some people just don't want to spend money on all these different procedures when an implant is probably more predictable. Number 3 is if you have an infection. Now, sometimes you can save a tooth that has an infection with a root canal instead, but that's a conversation you're gonna have with your dentist to go over your options. But sometimes you're just in a lot of pain and you don't have that much money, and you want whatever's gonna get you out of pain the fastest and the cheapest way possible. Number 4 is if you have a root fracture. So in this case, a tooth may look normal from the top, but underneath the tooth, where the tooth is in the bone, one of the roots is fractured. In this case, there's really no way to save the tooth anymore, and it probably has to come out. So usually this can happen because of some type of trauma to the area. So if you get in a fight and you get punched in the face, or if you bite down really hard on something, one of the roots in your teeth can fracture. Number 5 is periodontal disease. Periodontal disease is a disease that affects both the gums and the bones that surround your teeth. Now, this doesn't happen overnight. It'll start off as gum disease, which just affects your gums, and as it gets worse, it can progress to the bones that surround your teeth and turn into periodontal disease. So periodontal disease is terrible because it's irreversible. Once you start losing that bone around your teeth, you can't get it back. And you'll start to see these deeper pockets form around your teeth, and over time, your teeth will get more loose, and it can get to the point where your teeth are no longer savable and they have to be pulled. Number 6 is your orthodontist. Sometimes your orthodontist, or the person that puts on your braces, will want to take out some of your teeth to make room for your other teeth. Now, this is usually a last resort. Usually they will try to expand your jaw and make room for all your teeth that way, but if that's not possible, or if that's not something you want to do, then the only other option is to pull some of your teeth. Number 7, and the last thing on my list, is if you have impacted teeth. An impacted tooth is basically a tooth that doesn't have room to erupt. So sometimes these teeth will just hang around in your bone and just never really cause any problems, and other times they will start to damage the other areas in your mouth. Now, this is usually seen with your wisdom teeth. You know, those teeth that are always stuck back there and causing problems for no reason? Wisdom teeth that get impacted can cause problems with the teeth around them. For example, sometimes they can cause resorption or a cavity in the tooth in front of them. This is because they're putting so much pressure on that tooth trying to erupt that that tooth starts to form a cavity. Other times, your impacted wisdom teeth will partially erupt, or part of them will stick above your gums and the rest of the tooth will stay underneath your gums. In this case, you can get something called pericoronitis. And this is basically when that gum tissue that surrounds that wisdom tooth can start to get inflamed, because it's really hard to keep it clean and food can get stuck back there, and this can be really painful. So there's a lot of reasons you might need your wisdom teeth pulled out, but this is probably the most common. Thank you guys for watching. I hope you liked that video, and if you haven't already, please hit the thumbs up button and subscribe to my channel below, and I'll see you in the next video.